So for today, next slide please. So for today, we will discuss the definitions of the biomech FOR and range of motion, as well as both evaluation and intervention. So to start off, next slide please. Next slide please. Thank you. So to start off, biomechanical frame of reference, it is considered as a remedial approach focusing on impairments that limit occupational performance. So occupational performance, as we all know, direct siya nga to satisfactorily perform activities that are purposeful and goal-directed. So it would assume na if mag-engage ang occupation and mga activities that are therapeutic, it may remediate the underlying impairment of a client na mo result in an improvement sa occupational performance. So it was mentioned sa previous group ang function dysfunction. So I am going to mention na lang the domains of concern under function and dysfunction. So we have structural stability, low-level endurance, edema control, passive ROM, strength, and high-level endurance. So here, one of the goals would be to prevent limitations of range of motion, to move the target body part to full range of motion, either passively or actively, and to position the body to prevent contractures and edema. So evaluation under this FOR includes mga performance components on movement, strength, endurance, and pain. Ang interventions naman associate siya with this FOR include ADL retraining, we have active assistive, passive range of motion exercises, and others. All of which mo aim siya to improve underlying impairment and result in enhanced occupational performance in desired occupations. Next slide, please. Next slide, please.
So for the range of motion, it refers to the ability of the joint to produce motion. So it involves the angles and direction of human movement. So including extension, flexion, abduction, adduction, and rotation. And for muscular dystrophy, they are noted to have difficulty in rising from a lying or sitting position, problems with walking. They also have difficulty, muscle pain. They also have muscle pain and stiffness, lack of muscle tone, trouble lifting objects. So given just a few of the symptoms, different types of muscle dystrophy, we can say na greatly affected ang ilahang range of motion, thus also affecting their everyday occupation. So we have here the different types of range of motion under the biomechanical frame of reference. So first we have the functional ROM. So mo ni siya ang ROM that is needed to perform functional movements like reach the top of the head or small or the back. And then we have the active range of motion. So mo ni ang contractile structures na movements to produce by one's own muscle. And then we have the passive ROM. So mo ni ang non-contractile structures. So mo ni ang mga movement produced by an external force. And then we have the active assisted range of motion. So this is the movement na produced by one's own muscles and assisted by an external force. And then we have the last one, which is finger ROM, or the total active motion and total passive motion. So therapists either use PROM or AROM. Then this is to manage problems either preventive or for remediation. So we all know naman right na ang ato ang range of motion kay mo ni maka-measure sa ato ni siya i-measure through goniometer. So the evaluation for ROM will be further discussed by the next reporter. Next slide, please. Next slide, please. Thank you.
Okay, so di ba guys, we learned na muscular dystrophy, it is a group of the diseases that cause progressive weakness and loss of muscle mass. So it is marked by degeneration of our skeletal or voluntary muscles, and this will these muscles control our movement. So individuals with muscular dystrophy, di ba, they usually exhibit contractures because of shortened muscles sa joints. And then, due to abnormal and sometimes painful positioning of the joints, they may experience extreme fatigue, weakness, motor limitations, like fine motor limitations, and their mobility is also affected. So, all of these signs and symptoms, they would affect the individual's physical ability, their movement, and thereby limiting their motor skills and range of motion. So, for example, sa Duchenne muscular dystrophy, as muscle wasting progresses, the active ROM decreases. So the individual can be left with contractures at the elbows, the hips, and the knees, as well as severe deformities. So limitations in one aspect, like our ROM, this would significantly affect our engagement in simple tasks or meaningful activities or occupations, and that's where occupational therapy comes in. Next slide, please. Kang, can you exit sa kay I think wala nag-reflect ang new changes sa amo ang PowerPoint. Pwede mi pa. Thank you. Okay na Kang, pwede na i-present balik. Thank you.
So for evaluation, the standardized method for measuring ROM is using a goniometer. For active range of motion, this is when opposing muscles contract and relax, resulting in joint movement. You ask the child to perform a certain movement. And also for our evaluation, we have functional assessment. Next slide, please. Which is for non-standard evaluation. This is to check and observe if the child is can perform ROM or has joint flexibility. For example, is windmill and next slide, please. Twister. Lastly, next slide, please. Rainbow fine motor activity. Okay. So now we're gonna be showing a video.
Be sort of baseline normal. So one of the first tests, and you can easily assess any child, is that we like to see feet together and then squat all the way down to the ground, keeping the feet together and heels on the ground. What this lets us know is that we have full range of motion in the hip and full range of motion in the ankles. What we tend to see is that when kids start to get a little bit stiff or in compromised positions, they lose the ability to flex the hip, bring the knee to the chest, and they lose ankle range of motion and ankle flexibility. Excellent, Caroline. Stand back up. That's brilliant. The second test, while we're doing standing, is that we're looking at her arm, head over her, raise your arm straight up over your head, Bear. What we're looking for is that when kids get a little bit stiff in the upper back because they're rounded and bent over, they lose the ability to put the arms straight up. So just if we lock the arms over the head, and grab your own thumb bear, what we should see is that her arms can go straight up and down, and then we don't also create what we call a banana back. So rib cage is down, right? And she's maintaining a neutral spinal position. What it looks like when kids compensate, can you stick your bum way back, Bear, and overextension with banana back? We'll see a big sway in the back, and arms will stay forward of the head. So a quick, easy overhead assessment with the arms straight, arms are locked out. We try to minimize any change in spinal position. We're looking for straight up and down shape, just as if she was maintaining a standing position and arms go straight up. What we find is that a lot of our children get stuck here, and that's a result of being stuck, bent over a chair or in technology devices. The third position is what we call the couch stretch. What we're really looking at is assessing the ability to extend the hip. So, Carolyn, will you go ahead and get against the wall for us? The setup is easy. Carolyn puts one knee in the corner of the wall, foot straight up, and then the other leg just comes out in front of her. So point that toe a little bit more, Baron, behind you. There you go. She's got some tricky shoes on. Can you push that knee all the way to the corner? Can you put the knee all the way to the corner? So Carolyn puts her knee all the way to the corner, and then easily we should be able to maintain an upright torso with the leg straight behind her and this leg just vertical. What we get in this shape is that we're looking at sort of the impact of the quads or potentially stiff quadricep muscles of the leg and potentially any limiting factor of a short anterior hip. So while this stimulates a lunge, what we're really looking at is because her knee is behind her hip, and we've loaded up the anterior structures and the physical structures of the leg, we can quickly assess whether or not she has the ability to run fast or extend the hip. So this is a fundamental human shape and one of the first and most easily compromised positions secondary to long periods of sitting. Thanks, Caroline.
So next we have intervention. So under intervention we have activity adaptation. So this involves changing the activity demands to reduce or increase biomechanical requirements, using activity as a means of establishing or restoring ROM, strength, or endurance. The attributes of task may be modified by number one, positioning the task, number two, adding weights or other devices that provide graded resistance, number three, modifying the tools to increase or decrease demands, number four, changing the materials or size of objects used, and number five, changing the method of accomplishing the task. Next slide. So next we have stretching exercises. So stretching involves moving an individual's body part, example the arm or leg, to their comfortable, available, and range of motion. So stretches should be performed with a slow, gentle movement and holding the position for a specific length of time. So an example under stretching exercises is passive and active stretching. So the therapist will perform gentle passive stretches for the child, gently moving their legs and arms, and they will teach the parent and the child how to perform these active stretches in order to increase joint flexibility, which is the range of motion, and prevent or delay the development of contractures. So the potential benefits of doing stretching may include temporary improvement in blood flow to the muscle, decreased report of discomfort, a feeling of well-being, temporary increase in tolerance to strength, temporary decrease in muscle stiffness, and continued movement through the joint's full available ROM. Next slide. So next we have serial casting. So serial casting may improve ankle range of motion in selected individuals with Duchenne who have mild ankle tightness at the heel cord and have the ability to straighten their leg when sitting. So serial casting should only be done by an experienced PT. Serial casting is an intervention to gradually and progressively improve the ankle range of motion. Serial casting is a non-invasive approach to reduce the muscle tightness and limited range of motion of a joint to improve the patient's function. So serial casting can provide the following benefits such as increased flexibility, improved ROM, increased tolerance to manual stretching, and improved fit of splints or braces. Next slide. Now we'll be showing a video.
This selection of stretches is offered as a guide only. They should not replace the program and advice given by the child's primary therapist. Contractures develop because not all muscles around a joint will weaken at the same time. As a result of this, boys will develop compensatory postures and ways of walking. The tendo-Achilles is often the first to tighten. Gastrocnemius and soleus muscles insert into the tendo-Achilles. Stretches should be introduced early and incorporated into the daily routine. Active self-stretching may be possible. The usual sports stretch against the wall is easy for most boys. The gastrocnemius muscles can be stretched first. It is important the toes point forwards and are turned in a little as well. The heel is kept firmly on the floor. With the front leg bent, the boy leans towards the wall until a stretch is felt in the back of the calf. A stretch for soleus can be done in this position, but this time both knees are bent. The boy leans into the wall, bending the back leg until a stretch is felt in the lower part of the calf muscle. His heels must remain on the floor. Passive self-stretches can be done on a rocker board against a wall. Positioning is extremely important. The feet should be slightly pigeon-toed to ensure the tendo-Achilles is being stretched. A self-stretch for the hamstring group can be incorporated into the daily floor activities when playing or reading. Note, the knee should be straight and slightly out to the side. Another popular hamstring stretch is done by lying on the floor in a doorway or against a post. The boy moves as close to the wall as possible with his knees still slightly bent. He then straightens his knee against the wall and holds this position, keeping his hips on the floor. When performing manual stretches, the important points to remember are to position the child so he is well supported and comfortable. Stabilize the joints, which are not being moved. The intensity of the stretch should be submaximal and should never cause pain. Hold the stretch for as long as possible, as a prolonged stretch permits the muscle spindle to habituate to the new length and allows the lengthening reaction to occur. Overstretching is to be avoided as the muscle responds by contracting further. If the boy actively resists, a lengthening contraction occurs which may cause further damage to the muscle fibers. Manual Achilles tendon stretches should be taught to the family very soon after diagnosis. The child lies on his back in a comfortable position. The operator cups his heel firmly in one hand and rests the sole of the foot
Group
on
2,
her
I think we're running out of time, no?
She stabilizes above the knee.
Let's skip the video na lang. Do you have anything else to say?
Wala na, miss.
Okay. So these are actually good videos, no? Daghan actually dyan sa YouTube that can help you with your range of motion exercises and your assessment. So quick question lang, do you use the gonyo to assess the range of motion of a child?
Yes, miss.
Yes, miss.
Yes, if kung sa may requirements yapon.
Miss,
Kung sa may prerequisites sa child para mo use mo gonyo sa child. Okay. Your child has to be able to saman. The same as MMT. Group 2.
Try, miss.
Yeah.
Kanang makadu siguro siya, miss, niya if kuhan kay dili makaya kay mag-passive siguro, miss. Or
Ito may
kana na ay
prerequisite para
functional
mo use mo gonyo. Ha?
kanang kuan siguro, miss. If like dili siya able siya modugan miss, like dili gabi ka limited iyahang ROM.
I think you will know man siguro by using the goniometer na if limited ang range of motion sa child or not. Pero sa may dapat na anak ability sa child before mo magbuhat og goniometry. The child needs to be able to follow instructions gapon, guys. Diba, when you do range of motion, it needs, just like MMT, kailangan specific position, kailangan correct position, kailangan maka-maintain ang child sa position, diba? If your child is old enough or has the cognitive abilities enough to follow these instructions, then you can actually use your range of motion or goniometry. However, if dili kaya, then that's when you can do the functional assessment of range of motion. Okay? Just like as discussed earlier, functional ROM means you can use the available movements for functional activities, just like reaching the back, reaching overhead, diba? Is that clear?
Yes,
Now
miss.
for the range of motion na intervention, aside from stretching, what else can you do? Okay naman ang stretching if your child is able to follow instructions gapon na maka-maintain siya sa position, diba? Maka-follow siya ng instructions, na siya work behaviors na good to be able to follow those activities. But what if wala? What if kiyatin yung child? How would you give the treatment for range of motion?
Kuan, miss. Mga play-based na activities na nag-incorporate sa same movement that would kanang improve the joint flexibility of the child.
Okay. So you can use there are a lot of play activities that can let the child perform the range of motion kailangan. Okay? So you have to be resourceful Jud, when treating children. No? Kailangan fun and exciting for them para mo follow sila. Okay? Any questions for range of motion? Lastly, Jade, what is your goal for range of motion? Do you increase the range of motion if ever sa inyong clients na na-deteriorate na ilang muscles?
For muscular dystrophy, miss, kay since lowered man nila hang range of motion, so ang goal kay i-increase ilang ROM o joint flexibility, miss. Since na sila yung mga stiffness or muscle weakness ing ana.
Okay. Actually, no, you try to increase the joint flexibility. Now, take note, guys, that joint flexibility is different from active range of motion na kailangan ng muscles dyan. Remember, if weak ang muscles sa inyong child, then most likely, dili siya ka-perform sa full range of motion against gravity, right? But you still need to be able to maintain or increase the range of motion for joint flexibility and stability. So you do active assistive range of motion or passive range of motion. Okay? All right. Let's move on to the next group. Quick lang, please.